Hello, my name is Jim Sapersky. I'm the Chief Executive Officer at nView Health. And first, I'd like to thank the Technology Association of Georgia for honoring nView Health as one of its 40 most innovative companies. And we'd like to thank the Georgia Technology Summit for hosting us here. And last, we want to thank you for visiting our virtual booth. In the next couple of minutes, I'd like to tell you a little bit about nView Health, what we do, why we do it, and why we think it's really important at this time in our lives. First of all, who is nView Health? We're a team of technologists, trained behavioral health specialists and experts that have banded together to try to improve the way that we identify and treat mental health illnesses in our country. We are the premier provider of evidence-based solutions in that respect, and we provide a continuum of care across the entire spectrum of dealing with a patient from the point of intake and then to monitoring and tracking their patient outcomes. The reason we do this, there are huge problems in our healthcare system today. There is a chasm between mental health care and healthcare. And as we like to say often around here, mental health care is healthcare. Historically, it's been stigmatized, not much talked about, and clearly that was the case prior to the pandemic. If there has been a silver lining in the pandemic, perhaps it's that we all realize that mental health issues are something we all deal with, directly or indirectly, in our families, with our friends. And there's a critical shortage of trained mental health care professionals, psychiatrists, psychologists, therapists, clinicians, who have the skills and the training to help us deal with these mental health care problems. The pandemic has been a massive accelerant on that. It has exponentially increased the level and the types of issues that we are dealing with both in our country and abroad. There's a zero continuum of care within our healthcare system as it pertains to mental health. We typically have treated it as come and someone does an assessment, does a discussion, come back and see us in 90 days. How are you feeling? A little bit better. Okay, try this. And there hasn't been quantifiably looked at. We haven't looked at data. We haven't tried to manage patient outcomes on data. And that's coming. The whole premise behind value-based care and measurement-based care is tracking and documenting what you've done, showing that, in fact, as providers, we are improving patient outcomes and how we're doing that. And if we do that correctly, the cost savings are astronomical. We spend inordinate sums of money on what I would call misdirection, misdiagnosis, going down the wrong path today because we lack the right tools for our clinicians, therapists, and physicians to use. The issue we're dealing with largely is that when we're sick, we all go see the doctor. There are not nearly, or nor will there be, in any time in the near future, enough trained psychiatrists, psychologists, therapists, telehealth or otherwise, AI chat bots, technology. This is a problem that technology can mitigate, but a problem that's going to be with us for many years to come. And certainly the impact on our youth and our children as a result of the pandemic is something we will be dealing with a decade from now. So the result is we go see our doctor where we're not feeling well. We can't get in to see a psychiatrist, don't know where to go. There may not be one available where we are. I can't see the psychologist, so I'm going to see my doctor. And they're doing the best they can. The problem is they lack the psychiatric training, by and large, and typically they rely on assessment or tools that are at hand. Now, these tools that are at hand are a huge part of the problem because the typical assessment tests being used in our healthcare system today are old, they're antiquated, they're one-dimensional. They may look at one problem, not multiple problems. The result of that is we are misdiagnosing most of the major mental health problems in this country and around the world, frankly. We're getting it wrong more than we're getting it right. And that's unacceptable. We wouldn't accept that in any other area of healthcare. So what nView is out to do is to use clinically driven and validated and evidence-based measurement tools that have been in the clinical research and academic research for environments for years, and bringing those into clinical practice to help mitigate this problem. Our rural communities are especially challenged. That's an area we focus on, community health. How do we get this out to the broader population? How do we solve a problem with someone who's dealing with a mental health problem in rural Georgia that has to drive 200 miles to see a trained psychiatrist? It's particularly worse if you're a child. Over 50% of the counties in the United States do not have a child psychiatrist within the county. So I have to go somewhere, or I do have to rely on telehealth, or I do have to take advantage of digital technology or digital health technologies to try to mitigate that. And that's where we can come in and help. So there's accessibility issues, availability issues, and acceptability issues. The acceptability of the stigma of mental health still exists more in the rural environments than it does in our urban environments. Some of that is access, some of that is availability, certainly, that leads to that problem. But hopefully, if there's a silver lining in the pandemic, we're all much more accepting of the fact that we're all dealing with these issues today. 1 in 5 Americans before the pandemic were dealing with a mental health illness at some point. Today, that number is as high as 50 or 60%, and that's due to the pandemic and the impact of the pandemic. So the problem is worse than ever. It's not going away with the vaccine, and it's going to be with us for years. So we simply have to do something better. What we provide at nView, we provide short screens for adults and children in different ages of children, 6 through 8, 9 through 12, 13 through 17, because they're all handled differently. That provides a screen. What's going on? What's the underlying problem that this child or this adolescent might be dealing with, or this adult? We look at 24 pediatric disorders in one fell swoop. We look at 17 adult disorders in one fell swoop. Based on the test of the screen, we can then, which is a 3 to 5 minute test that's taken in the office, can be emailed out ahead of time, can be sent to a mobile device and done there. We go into an interview. The interview may take anywhere between 15 and 20 minutes, depending on the severity, for children and for adults. Again, looking at multiple disorders on the pediatric side and multiple disorders on the adult side, with a high degree of accuracy, a high degree of efficacy, which is really, really important, to help the clinician, physician, primary care doc, for instance, get to the right diagnosis, really understand what's going on with this patient. At that point in time, we provide a series of trackers and monitors and severity measurements that can be automatically set up to go out to this patient's mobile phone once a week, once a month, once a day, depending on how frequently we want to track them, and find out how they're doing and quantify that, put that in real average standardized score data that we can then track and monitor. Because at the end of the day, it's tracking the data. It's looking at what the scoring is, how is that patient doing, and using that data to make decisions, particularly in environments where that help is needed. And it's needed in 80% of the cases right now, because 80% of the country's mental health prescribed treatment is coming from our primary care doctors, again, who generally lack the psychiatric training. And 85% of the prescribed medications that are going out to deal with mental health problems in our country are coming from those primary care doctors. So we just have to do a better job. I want to thank you for visiting nView. If you have any questions, we'd be delighted to talk to you at any time. You can reach us at www.nview.com. And again, a big shout out and thank you to the Technology Association of Georgia, and I hope you enjoy the summit.